Hey, Margie here. Are you ready to learn about a type of movement education that is so powerful, can have you feeling better than you've ever felt in your body? Well, if so, you're in the right place because today we're talking about the Feldenkrais Method. And we have a very special guest, Robin Eisen. And Robin has been a physical therapist for over 48 years. She's a certified Feldenkrais practitioner and has studied numerous modalities, including EFT tapping. After teaching physical therapy at the University of Illinois for 9 years, she started a private practice in 1987 and now serves people virtually all over from Michigan City, Indiana. Her passion is empowering people to discover their unique path to health. And in today's talk, we delve into the Feldenkrais method, how this amazing method differs from traditional exercise programs, and how it can help our bones, our overall health, and even elevate our happiness. And Robin takes us through two great lessons using this method. So this should be lots of fun. Stay tuned. Welcome, Robin. I am really beyond excited. I have to explain to everyone our story, but just welcome, welcome. I'm so happy to have you here.
Well, I'm so grateful that you brought me on, and you're very welcome because I love to share my knowledge with people and your tribe. So let's go.
Yeah, so before we get started, I just have to tell everybody about how we reconnected. This is just such a great story. So Robin and I worked together, I think around 34 years ago in Evanston, Illinois. And we were the only two physical therapists at this one clinic, and we got very close. And then I moved and we just sort of lost touch. I don't know why, because we were
Life.
really good friends, right? But we just moved and truly lost touch. And so then I did several years ago, the part of my happiness training was being mentored by Marcie Shimoff. And then Robin lead, all of a sudden I see we have a group of people who've taken this training, and we keep meeting once a month. And all of a sudden I get an email from Robin that she's in this training and saw me speak. And I just couldn't believe it. So we reconnected, and this is so exciting because right before this, I really wanted to find a Feldenkrais practitioner to have talking about bone health and overall health, because I think Feldenkrais method is beyond amazing, which you're going to hear. And I forgot that, Robin, I think you had started the training actually back then. You hadn't finished it, I guess.
I
But
finished in 94.
oh, right. So that's no, because I'd moved way before that. So you had just
Hmm.
started. So I hadn't really put the two together. So this was just really exciting. And anyway, so today we're going to talk about the Feldenkrais method. And I'm just so thrilled to have you. So let's get started. How did you get into, so we're both physical therapists, but then what made you get into the Feldenkrais method? And tell everyone how you got into it, and then you'll explain what it is.
Yes. So, as a physical therapist, I think I always had an issue with rote exercises. Something just didn't feel right about it, but I didn't know how to navigate to do something differently. And I had my own back injury early in my physical therapy career and wasn't getting good results with just PT. And someone invited me to a Feldenkrais class. And the teacher, Gabi Yaron, ended up being my mentor. But within 5 minutes of seeing my posture and seeing me lying on the floor, she came over. She knew exactly where my pain was. She looked at how my sacrum, the very lower part of my spine, was lying on the floor. And she said, we have to change that. And I'm like, okay, let's do that. So I ended up taking a 3-year training in Feldenkrais, partially for my own journey into well-being, and then was using it in my practice because it was just what I needed. It was just what I was looking for, to take people to a level of internal learning that is quite different from just doing exercise.
Oh, wow. Before you explain about Feldenkrais, I want to share my Feldenkrais story too. So I was working prior to meeting you, Robin. I was working at the hospital in Evanston, and I had a patient, a little girl who had scoliosis. I went on vacation for a week. I come back, and another therapist had seen her who had training in Feldenkrais, who had some training. She wasn't a practitioner. I come back, and she was so much better. I couldn't believe my eyes. And that was the first time I saw how powerful this technique is. And so then I did lots of training for physical therapists, not the same intense training that you did. And I use it all the time. It is incredible. And anytime I've gone to like a 3-day workshop, I've never felt better in my life. I come out more aligned and loose and moving, and it's just part of my life now, somewhat, but it's just fantastic. So continue your story about what Feldenkrais is. Why don't we
Yeah, I
explain it?
think it's a little easier to understand what Feldenkrais is if we first talk about what it is not. So I already alluded to the fact that it is not rote exercise. And we talk about Feldenkrais as a learning. So it's called the Feldenkrais Method of somatic education. We educate our bodies on how to move, not necessarily on what you're doing, but how you do it. And it's going internal and learning how you approach a movement and how much of your body you can incorporate in the movement. So it's not exercise, it's not yoga, it's not massage. It's really a method of educating yourself how to move. And so the practitioner doesn't tell you what to do. It's not like move this way and repeat it 10 times. It'll give you a prompt to move in a certain direction, and then you go inside and try to figure out how to get there. And then we might add what we call a constraint to actually make you move a certain way. But again, you have to go in and figure it out, then take the constraint away, and for you to figure out how to move more efficiently, more gracefully, using your whole self.
But the best
I
part
hope that
is
was
that,
clear.
yeah, the best part is that you don't have to figure it out in your mind. It's just a matter of certain movements that are re-educating your body. And I love they always called it awareness through movement. So you're re-educating your body, just like you said. But you're not thinking, oh yes. And I think that's one of the big differences. Sometimes, if you're in physical therapy, you're thinking, okay, I'm strengthening this muscle and I have to do this exercise, where you're not thinking about anything. You're just doing these very different movement patterns, but in the process, you're re-educating. So do you want to tell a little bit about Moshe Feldenkrais and how he devised this amazing method?
So Moshe Feldenkrais had a very interesting journey in his own life, which we won't go into, but he was a physicist and had terrible knee injuries, war injuries, and he did judo, and he was basically told that he needed surgery and he was never going to recover. And so he himself went internal and tried to figure out what could he do to have himself move better, and was able to recover. And then he had friends and family saying, well, what did you do? And then he started playing with their bodies and teaching them how to go inside and figure out how to move. And he developed the method. Um, and, it's been around for a long time. He passed away, I believe, in 86. He's trained quite a few people. And then those trainers have trained other people. So, it goes on. There are two different parts of the Feldenkrais method. So one is the awareness through movement that you already mentioned, which is verbal directions that people will then take internally. It could be done one-on-one or in a group setting in a class. And then there's something called functional integration, where the practitioner actually puts their hands on the person and guides them as they're internally figuring out how to do a movement. So it's a guided movement. And then you give people things they can do from a verbal direction.
Fabulous. So you can do, like, different people can, well, everybody can really benefit from both, but that's nice that there's two options. So people can, what's great about Feldenkrais is that you really won't hurt yourself by doing the awareness through movement program, because it's very gentle and your body really, am I right about this? It's not going to let you, like if you're listening to a video or following along and doing these the movements,
Well, there's a
Yeah.
caveat there, Margie, and that is why this is called an education approach, is that depending on how the person approaches the lesson will determine their outcome. And people can do too much. If you
Right.
are a very type A personality and you're looking at for the end result and the goal, you might do the repetitions more times than your body wants to. You push through, and that's a learning. Then you have to go back inside and go, okay, well, what if I did it 5 repetitions instead of 15? And and navigate the learning piece. So it's really a whole body educational approach of how you approach life.
That makes total sense. So in terms of who could benefit from this? Like, what have you seen in your practice?
So my practice is geared towards chronic pain. Being a physical therapist, that's my tribe, so to speak. But people who are accomplished musicians, actors, people who are on the opposite end of the limited mobility pain scale, but are very fit, can also benefit because again, it's going in and learning how can I become even more efficient? How can I do this with more ease? How can I be more graceful? So it works with babies who are limited in their mobility and or are developmentally delayed because you can do the functional integration and they don't have to take it in verbally. You can teach parents how to work with their children, and then it goes all the way up to the aged. So anybody along the spectrum from disability to fully accomplished artist can benefit from always doing more,
And it's so
more
interesting
efficient.
because even one session, you will notice a difference. It's not as though, oh, you have to do 10 sessions and then maybe you'll see one session you're changed. And the other good thing is it's not as though, once your body relearns a different movement pattern, a lot of times it just sticks with you. So it's really one of the most powerful methods that I know truly to make lasting change, and especially in areas of posture and alignment. It's
Mhm.
incredible. So let's talk about bones. Like, how do you see someone who has osteoporosis or different issues where this fits?
Well, I use a silly little paradigm of if there was a crooked man who walked a crooked mile. If you are not in alignment, no matter what you do, whether you're sitting at your computer or you're exercising at the gym or you're taking a walk, if you're not stacked and your bones are not aligned, then any force that you put into the system is not going to go through either efficiently or where you want it to go. So if you're in an osteoporosis program and you're being given weight bearing exercises and other activities and your nutritional program for your bone health, you really want to pay attention to your alignment. And getting back to what you said, Margie, is you don't have to think about it. That's what's so nice about organic learning, because I remember as a kid, my father used to come up behind me and touch my shoulder blades because he thought I was too rounded forward. He wanted me to stand up straight. I could do it for 30 seconds. I could get back into a good alignment and pull my shoulders back. But then as soon as I started doing something else and I wasn't attending to it, I couldn't maintain the posture. When you go in and do a Feldenkrais lesson and you're doing it internally and organically, your brain likes more efficient, less complicated, less painful movement. So it's going to try to recreate and move into that direction. Now, you know, for a lot of people, they do need to revisit a lesson until it becomes totally ingrained. Like you said, some people get it and their body hangs on to it forever. Other people are going to have to come back and revisit a lesson or do more than one lesson or see a practitioner, depending on where they're starting from. So you repeating one Feldenkrais lesson over and over again is not interesting to the brain. You want to mix it up. We're constantly giving the brain different information, because if I do a Feldenkrais lesson and I do the same lesson every day, eventually your brain says, boring, been there, done that, what are you telling me, right? And it'll kind of tune it out. So we want to stimulate the brain, we want it to pay attention and then say, oh, well, that's interesting and that's better, and I'm going to choose that motion from now on.
And that's what I love about it in terms of posture and things, because I think it's one of the really easiest and fastest ways to make lasting changes. Because, and so many of us have patterns that we've had for so many years, but when we give the brain another option, it's just incredible. Why don't we do something now? Because people might be
Yeah.
listening and it's
Yeah.
sort of making sense, sort of not making sense, but maybe let's do a little exercise so people can actually have a better understanding and get a little bit of feel about this.
Great. And we'll do something very specific to posture. But the first thing, and of course, if you're driving, operating equipment, come back and listen to the podcast later. If you remember it, do it at a later time. But for right now, for those of you who are sitting and listening, just to give you an idea of how we wake up the brain, just interlace your hands, just like, you cross your hands as if you're going to put them in your lap. And notice which thumb goes on top. So you've interlaced your hands and you've got one thumb on top. Now go ahead and take your fingers apart and interlace your fingers the opposite way so your opposite thumb is on top. And just notice how that feels. For most of you, it's not comfortable. So if you go back and interlace your original way, you could put your hands in your lap and you wouldn't think about it at all. It's going to in the background. But if you interlace them the other way, all of a sudden your brain is saying, oh, that's different, right? And you're starting to pay attention. And if you put your hands in your lap, it may not fall into the background as quickly. So that's just a very simple thing to show you how we are trying to get different pathways into the system, wake up the brain and say, oh, that's interesting. I'm going to pay attention to that. So if you're sitting now, and a lot of you are probably sitting in front of your computer or your mobile device, either watching or listening to this, just make sure you can get both feet on the ground and notice where you're sitting in your chair. Are you back in your chair so that you're using the support of the chair and your pelvis is kind of tilted backwards? Are you way forward in your chair so that your pelvis is kind of tilted forward? Or are you somewhere in the middle? Now, so I'm going to invite you to just tell your brain to remember what you feel in sitting. Like, where are your feet relative to the knees? Where are your knees relative to your hips? Where are your hips relative to your pelvis? Where's your pelvis relative to your spine? So if you were sitting way back in your chair, your pelvis might be behind a little bit. If you're sitting right in the middle, then your spine might be stacked right over yourself. And then if you're leaning a little forward and spilling the pelvis forward, then everything is taken in front of you. So I'm going to invite you now, if you are sitting against the back of the chair, to just scoot forward a little bit away from the back of the chair, have both feet on the ground, and notice your sitting bones. So underneath each of your buttocks, or inside your buttocks, you have two sitting bones that are at the very bottom of your pelvis. And notice if you have weight more onto one ischium, one sit bone, or you have weight towards another sit bone. So is it the right or the left? Or do you feel you have weight equally on your two sitting bones? There's no right or wrong. It's just noticing what you do. Where are you in this moment? And then noticing where your sitting bones are and where your feet are, just push through both feet and see what happens to your body. So for some of you, you'll push through your feet and you start to feel like you get taller. You're actually translating that force up through the spine. It goes all the way up through your head and you feel your head go to the ceiling. For some of you, it may feel like you're pushing your pelvis backwards and you're going to go into more of a slumped posture where you're headed towards the back of your chair. But just notice what you do. And then push just through your right foot. And when you push through the right foot, notice now where does that force go? So for some of you, it's going to go into the right hip. For some of you, it's going to take you over your left sitting bone. And then you may feel your whole body go to the left. Again, put it in the memory bank. What did you do? Now go ahead and push through the left foot and see what happens. And it may be the same as what happened on the right side. It may be different. So for some, force is going to go into the hip, push you backwards. For some of you, it's going to take you over to your right sitting bone. And then just come back. Now, when we're doing a Feldenkrais lesson in real time, we would give a lot of rest in between all these cues because you want the body to take it in, sort through what felt right, what felt good, and then come back to another prompt, and you see how they integrate. We give the body time to integrate the pieces. So I'm going to go a little bit faster today just because, you know, we're going to give people a taste and don't have the luxury of the full lesson time. So now I'm going to invite you, without pushing through your feet, to go ahead and put weight on your right sit bone. And notice how you get there. And do you bend to the right so that your ribs start to collapse on the right side? Do you bend your ribs on your left side to get there? Or do you stay completely elongated? Again, no right or wrong. Notice what you do. Do I bend? Some people are going to bend this way over to the right. Those of you who can't see me, but I'm actually side bending to the right, and I get weight over the right sit bone. Some of you are going to stay vertical and just shift your body over to bring the whole body to stay vertical, but put more weight on the right. Some of you are going to bend to the left to get more weight on the right sitting bone, and the left one will lift up. And come back to the middle. And just notice, even from that little bit, whether the position you come back to is different from your normal MO. You know, is it where you started from? Is it already shifted a little bit? And we'll just take another few minutes. Go ahead now and push through your other foot and see where you go. I think I started with the left. I don't even remember, but pushing through the right foot, see how you spill over to your left sitting bone. And then don't use your feet, and then go ahead and just shift over to the left sit bone. And how do you get there? Did you do it the same as to the right? So did you bend your ribs on the right side to get to the left sit bone? Did you shift your whole weight over so that your head is actually going now left? Did you stay vertical? And come back to the middle. And now just shift. Right sit bone, left sit bone. Right sit bone, left sit bone. And now bring your feet in. When I push through the right foot, go over to the left sit bone. When I push through the left foot, go over to the right sit bone. So now I'm using more of my whole body, right? I'm using the foot. I'm using the force through the leg to shift my spine. And if I think about my head going towards the ceiling, I start to get this movement of pushing and lengthening at the same time. And what's really nice about this movement for anybody that's sitting at a computer all day long, it is taking the weight of gravity a little bit off of the spine, the neck, giving you some length so that you're not in that collapsed, compressed posture, which, you know, when we're at the computer and we're doing things in front of us, our head tends to go forward. We compensate by spilling our pelvis backwards. We end up with this very collapsed posture, and then we complain about our shoulders and neck, and we're constantly trying to fix our shoulders and neck, when actually if we work on the pelvis and support our pelvis, it'll change the position of our head and neck. So go ahead now and just let everything go. Come back to a place of sitting and just notice for yourself what feels different. And what's nice about the Feldenkrais method is it's going to be different for everybody. There's no right or wrong answer, and the practitioner isn't looking for you to say one specific thing. It's an organic internal learning to take you to a place that's different for you, and there's no way it's going to match up with anyone else. I
Right.
hope that was clear and that you learned something about the Feldenkrais method and also about sitting and what you can do. And just one last thing, Margie, again, I know some of your people um, have osteoporosis or are a little bit older. All of these movements, again, as it aligns you and stacks you from head to toe, is going to make any other movement you do more efficient and make you less vulnerable to injury.
Oh, I loved this. I feel so great. I just,
Mm-hmm.
and that's something everybody can do. You could just do this when you're sitting. It will be amazing because as you said, it unweights you and just puts you in better alignment, and it breaks up, and it re-educates you. So what an easy, wonderful thing. Yeah,
Yeah.
that's
And there are thousands of Feldenkrais lessons. I mean, we do lessons with just the eyes. We do eyes lessons in lying, lessons in sitting, lessons in standing. Again, we're trying to bring in all of the parts of you, and you get to learn where are you holding and using more muscle effort than you need to, and where are you misaligned that actually could be causing injury that you can unwind and then prevent further injury from happening. So yes, it's an amazing method. I don't like to call it a cure-all, but there are very few people that don't benefit on some level from doing some
I have
Feldenkrais.
seen, as I said, I've taken numerous classes for physical therapists, but because it takes how many years, Robin, to become a practitioner? It's a serious training program.
Well, you get a certification from something called the Feldenkrais Guild, and right now their requirements are 800 hours of training to be done over a several year period. They prefer a 3-year period. So it comes down, and different teachers will break that up differently. So um, my training was 2 weeks at a time, several times a year, and then we might had a 4-week session in the summer. Some people do it for shorter periods over a longer period of time. So because people are working, they're doing weekends, but it's 800 hours over about a 36-month
Yeah, it's
time
quite an
frame.
intense training because they won't allow anybody who hasn't done it to themselves because you really need to figure everything out with your own body. Am I right with that?
Yes,
Yeah.
and you can do 2 years of training and do awareness through movement lessons. So after your second year of training, you can have classes and take people verbally, like I just did with you, after the 2 years. And then you need that an additional year to be able to do the functional integration piece, which is actually putting your hands on people. So, yes, quite a bit of training. You have to have some lessons with your teachers. You have to work on your teachers. You work on each other. You have to pass an exam at the end, actually showing that you can do the method. So, yeah, it's intense and it's life changing, for yourself as well as for the people you're going to work with.
I've always thought someday I would do it, but
Yeah, it's a lot.
I've just done the weekend courses for physical, which any bit of the Feldenkrais has been helpful to me. But
Mhm.
it's just wonderful because, as you said, you need to be aligned, and I think that's such an important concept, especially if we know that we want to do resistance training, and we know that the bones respond to the forces placed upon it. But just like you said, we have to have an aligned skeleton. And this is what
Mhm.
I think this is really, I actually think this is the best method. I do. I
Mhm.
mean, from all my work over so many years as a physical therapist, I found that the people that did Feldenkrais really were able to just really reduce fatigue, number one. I found
Mhm.
huge reduction in fatigue, muscle fatigue, and aches and pains because they were aligned. And so that whatever you put on top of that, or wherever you put that into your life, and lots of athletes do the Feldenkrais method because it's so helpful in so many ways, and musicians, as you said. So it's just amazing. It's funny you mentioned the eye thing. I think we have a minute. You want to just tell people can you do like a 2-minute eye thing? Because
Sure,
this is like
sure.
with just maybe turning their head or something. Because
Yeah,
this
yeah.
will really shock you,
Yeah.
I think.
So I'll do that in a minute. So I don't forget. I just want to mention there's not a lot of research here, but when you're talking about chronic fatigue, what the Feldenkrais method does, because you're going in and attending, it actually calms the nervous system. And we believe that it's affecting the amygdala, which is related to the stress part of our brain, where we're in fight or flight all the time and the amygdala gets triggered. And so it's just like doing a meditation, when you're meditating, you're attending to one thing, and meditation reduces stress. And they find that meditation will reduce chronic pain. So when you're doing a Feldenkrais lesson, you're also tapping into that pathway of helping the nervous system come into that parasympathetic state, which is our rest and digest state, and come out of that sympathetic fight or flight, which these days a lot of us are on that level. So I wanted to mention that.
Yeah, so that's great. What a wonderful benefit. Besides helping improve posture and this and that, you're also going to relax and reduce your stress, and it's great.
Yeah. All right. So this is one of Margie's favorites. So we'll do it.
It's just easy, and they'll see right away. Right? Am I right?
Yeah.
Besides, it's just interesting. Yeah. It's something I bet if you've never done Feldenkrais, you will have never done this before. Okay.
All right. So if you think about it, the way babies learn, right? One of the first things they do, they start to learn how to track their eyes. And when they move their eyes, everything goes with it. The hand they're going to reach, the head is turning. Mother walks in the room or they hear a sound, they turn, the eyes go with it, the body goes with it. Okay. We're going to use that concept, but we're going to mix and match it again to wake up your brain. So if you're sitting, just go ahead and turn your head to the right and see how far you can turn. And for a lot of you that have chronic pain, or again, that aren't fully aligned, you may find that you don't turn as much as you used to. Some of you may have trouble backing out of your driveway when you're in your car because you have difficulty turning. And go ahead and now just turn your head to the left and just see, do you have equal range of motion going to the right and to the left? Is it comfortable going to both sides? Do you get a little bit uncomfortable, or do you get stopped because you're stiff, or do you get stopped because of discomfort? Okay. And now go ahead and turn again to the right and just notice where your eyes go. Take your eyes with you. Come back to the middle. And now you're going to take your index finger, put it in front of you, look at your index finger, and go ahead and turn your head to the right while you're looking at your index finger. So you're going to be more limited in how much you turn, but as your head is turning to the right and you're looking at the finger in front of you, you're actually taking your head to the right, but your eyes are going left. So just do that a few times. And then rest. Again, we like to take a lot of rest in Feldenkrais. Let the body just take that short little motion in. Go ahead and put your finger in front of you again. And this time you're going to turn your head to the right and take your finger to the right. Now keep your head to the right, but take your finger to the left. So your head is to the right, but your eyes are actually now moving left. Bring the finger back to in front of your nose with your head turned to the right. And then take your finger left as your head stays to the right. Bring your finger back in front of your nose, and then bring everything back into the middle so you're looking straight ahead. For some of you, it may have been a little challenging. If it is challenging, if you found that your eyes were jumping, that tells the practitioner that there was some injury at some point where your eyes and your head weren't matched up, and the eyes start to jump. Some kind of physical trauma, or it could have been even an emotional trauma where the system got disassociated. So just from that simple move now, go ahead and turn your head to the right and see if you can turn any differently. And I have pretty good range of motion, found that I could turn more. So there's always a chance for change, and always a chance to wake up the brain. Was that enough, Margie?
Yes. I just want people to see, by just turning your head to one side and the eyes the other way, like whoever does this, but that changes up the pattern. And look what happens. You can see immediately that you have more range of motion by something that takes 2 minutes. Yes. So thank you so much, because that really illustrates how powerful this is. So that's
because the body is an integrated whole. And I think we forget that. And I know as a physical therapist, I was never trained to think about everything being connected. We had a foot problem, we worked on the foot, right? You had a shoulder problem, you worked on the shoulder. You can do so much more by pulling in all your systems.
So important. It's such a huge concept. I think with everything, as we talked about, the bones
Mhm.
are not in isolation. We have to work on all systems of the body. So same thing.
Mhm.
But
Mhm.
it's so let's just go over a couple things. So the options people have with Feldenkrais. So they can do just go over again, like how often, they can do the awareness through movement, the lessons. And
So,
how
yeah.
often, yeah, just tell us about the lessons. And when someone works on you, like how often do you recommend? If someone is listening saying, wow, this is for
Mhm.
me, like tell them what
Mhm.
options. Oh, let me
Yeah.
just say one thing I'm so excited
Yes.
about. I have to share this. So
Mhm.
Robin is going to be coming next month in January. I'm starting a reset program, and Robin's my guest, and she's going to do a whole Feldenkrais session for everyone in the program. So I'm just so excited about that because I think you're amazing. First of all, I've always thought
Oh,
you're incredible
thank you
at what
so
you've
much.
done. No. We used to
Mhm.
work on each other. I mean,
Mhm.
years ago.
Mhm.
And so I've always thought you were amazing, but this is going to be just so fantastic. So tell everybody though,
Yeah.
what things are, how they can integrate this into their life and what things are possible.
Yes. So with awareness through movement, of course, with COVID now, in-person classes, large classes, are pretty much shut down. There are some people that have a big enough space where they're doing social distancing and they can do a class live. I don't want to downplay all the tragedy of COVID, but the gift of COVID is that more people are now doing things online. So you can do Feldenkrais awareness through movement online. You can also do it with just audio because again, it's verbally prompted. The benefit of doing it either in person or on a Zoom call is that the teacher can watch you. And if you are doing something just totally out of the box, like not on the same page, or doing something they think could harm you, they can give you a verbal correction. A lot of times, if we're doing a side lying lesson, you want to be aligned properly. You need good support underneath your head so that your shoulder is free. So there are lots of prompts that we can give people, folded towels and things, so that they can be supported and safe. If you're going to do an awareness through movement lesson, there are people that do a lesson every day. But again, it wouldn't be the same lesson, either via a recording or a class. But at least once a week, I think, is good for your system. Take in a lesson, let yourself integrate it for a little bit. If you remember, you can repeat parts of that lesson after about 3 or 4 days, and then come back and do another lesson. There are going to be lessons that you like and that you're going to want to do over and over again. And remember, I said, be careful because it's not an exercise and you don't want to just do that same thing over and over. But the good thing is, like you said, Margie, when you do have it internally, you can come back to it. So, you learned a lesson and 6 months down the road, you're at your computer and all of a sudden something's bothering you and you go, oh, wait a minute. And you can take 3 minutes, do a little bit of the movement you remembered. Your body will remember. You actually can get a benefit of a full lesson in doing 5 minutes. So that's the beauty of keeping up with it. Functional integration, same thing. There are practitioners that are working with masks and gloves, so you can get the hands-on experience. And most people, unless they're severely involved, will do it once a week. If you do it only once a month, you may not be getting as much benefit. But if you're doing Feldenkrais classes and then you're getting a functional integration lesson once a month, it's going to help what you're going to get out of your class. So it's very individual, as you know, people have different physiology, people respond differently, and their needs are going to change. But an awareness through movement lesson once a week is usually a nice span of time, and getting a functional integration, if you can afford it, once a week or at least once a month, I think is useful.
But now in COVID, people, if they're not going anywhere, people can, the best thing is you can do this online and you can do the awareness to movement classes, and you teach that. They could, so
Yes, yes, I do.
and we'll
So
give
right
all
now
the,
I'm doing classes and I'm doing one-on-one. So again, it depends on individual needs. Um,
which is great. So if someone has an issue and you're worried about doing the class, they could work with you one-on-one. That's fantastic.
Right.
That's great,
Right.
because it's really, I don't, I get excited about things, but this is really amazing. Jane Brody in the New York Times. Did you see that article?
Yes.
Jane
Yes.
Brody wrote a whole piece about Feldenkrais, how it's helped her and how amazing it is, just to let people know about it. And I'm still shocked that that it's just not something people use still. When I mention it, oh, what's that? It's not a common term. It's not something everybody knows about, which, because it's so effective, I don't know why that's the case, really, that it's not out there in mainstream, just like everything else, because it's beyond effective. And it's,
Yeah.
yeah.
Yeah, it just hasn't taken off like yoga has. It may get there. It has a funny name. And, a lot of people like you and I, when we're doing something wonderful, we're good practitioners. We're not necessarily marketers, right? So I know the word just hasn't spread like it should.
Yeah, I think the other thing is that the training is much, much, much more involved. So there aren't as many people who are trained also as there
Hmm.
are yoga instructors and other things. But
True.
it's really, did you want to share anything else, like other things you've seen such benefit from? I mean, I think also, a lot of people with breathing right now, we're all so concerned about, are we getting
Hmm.
oxygen in our lungs? And this is an amazing method for that. Do you want to tell some of the things, other things that you've seen that it's really been amazing for?
Well, thank you for bringing that up, the breathing piece. So, for people with chronic lung conditions, COPD, people with asthma, getting the nervous system calm, one, and getting people in tune with their breathing pattern and then all the intricacies involved with breathing and how they can get air deeper into the lower lobes of their lung instead of just breathing up into the chest. There are several Feldenkrais lessons where we actually will teach you to breathe just into the upper part of your chest so you can see what that feels like. And then the middle part of the chest, and then the lower part of the chest, which no one ever thinks about. How can you actually segment that? A lot of what we do with Feldenkrais is in the imagination. So just intending and imagining a movement, your brain doesn't necessarily know the difference. You practice. That's what mental practice is, what athletes do. They're practicing a dive over and over again in their mind. They're actually training their nervous system to do that movement. So the brain says, oh, we're practicing a movement, even if you're not actually doing it in space. So, lots of different lessons tuning into the ribs, tuning into the small muscles between the ribs um, can help improve breathing patterns. So, I've seen a lot with people who didn't come to me because of their breathing, came to me with other issues, will comment on how they feel like they can take in a deeper breath. If they get upset and anxious, they feel like they're not going into their upper chest. When people have an anxiety attack and they start to do very quick, repetitive breathing, they have more control over their body and don't get taken over, I guess, by an emotional or other physical trigger.
Wow, and that's so important, because that's really a miserable thing when, when you get that panic attack and when people feel that everything tightening. So the fact that that helps is huge. Yeah, great. Any other things you want to share with everyone before we end?
Well, again, like you said, Margie, what's so interesting about this method is the changes that take place that you don't always expect because it is a total body approach. So, again, if someone comes to me, as a physical therapist and they have a referral from a physician and they just came out of a cast, we're obviously going to hone in on a particular body part. But when you're doing Feldenkrais with somebody and you're working maybe a little above and below that area, patients will come back and say, my foot feels a lot better since I came out of my ankle cast, but I have to tell you, I didn't get a headache this week sitting at my computer. I'm like, oh, I didn't know you were getting headaches. They didn't come in with that problem. We didn't talk about it. They may not have even put it on their history form. Um, but they noticed that as they changed how they move and how more efficient they got and went internal and got more aligned, that it changed how they're doing other activities. So that's what's so nice about it.
Ah,
And you're not honing, again, when you're doing an awareness through movement lesson with people or a functional integration lesson, we try not to hone in on what people are complaining about. Because again, the brain has gone in and focused on that. And we want to expand the brain to say, guess what? You've got a whole body here. Let's bring in all the body parts and not stay focused on the pain that's, taking you down.
so fantastic. We could talk for such a long time about so many things, but I think you did an incredible job of explaining it so people know this is possible. I mean, that's what I like to do on the podcast, share tools that I truly believe in. And I mean, I'm sure I love this method. I think this method, I honestly think it's so much more powerful. There've been so many people who I've seen in physical therapists that I've, as a physical therapist, have referred to Feldenkrais practitioners because I really believed they could exactly, well, you saw what happened with that one person with scoliosis. I mean, literally in a week, her spine looks completely different. It was shocking to me that something could be so effective. So anyway, this is just such a great method. I'm so excited that you were able to share this with us and that you're available as a resource for people if they want to explore this and see how it could benefit for them. So we'll have all the links to your classes. We'll have all the links that they can just get in touch with you. Is that the best way?
That would be great. Yeah, they can go to my website and send me an email to dragonflybodymindhealing.com is the website, and at gmail.com would be my email.
Okay, great. And Robin's going to be at my class. So anyone coming to my program for that month will get to experience a whole session. So yay. Anyway, this has been so much fun. And now that we've connected, we're staying in touch. So I'm not going to, it's not like I'm saying goodbye and I'm not going to see you for another 34 years. I'm really excited that we back in touch, and I know that we'll be doing a lot of things together. So thank you. Any last minute things before we leave?
No, I appreciate you having me on. I want to thank you for that opportunity to share, and you're so welcome.
Oh, well, thank you. It's been so much fun. I love the energy, and it makes me realize that I want to go back into doing more Feldenkrais because it does. I feel so good, Robin, from just what we just did on the pelvis. Oh, I feel like I've been at the computer a lot more than I normally am these days, and it feels great. So thank you.
Well, you're very welcome again, and bye to your tribe, and I hope you got something out of it.
We all did. Thank you so much. I hope you've enjoyed my interview with Robin and now a good idea of what the Feldenkrais method is and why it's so beneficial. All the links we talked about will be in the show notes. And I'm so excited because I'm starting my happiness and resilience program on January 5th. And this is designed to help overcome fear, fatigue, isolation, and discouragement so that you can bring joy, health, and happiness into the new year. And Robin is going to be in January our guest expert, and she's going to take us through an entire Feldenkrais lesson. So very exciting. You can learn more about the program in the show notes. So thanks for tuning in today, and I look forward to seeing you on the next episode.